Hello aspirants, so we can start the session of Targeting FMG Examination 2021 session with Anatomy MCQs discussion. So this is the 7th part of Anatomy MCQ discussion. So let's start with the session now. So all the best to everyone. So meanwhile, the students are joining. So this session is all about targeting the FMG examination, and this is the Anatomy MCQ discussion session 7th. So those who have missed out the previous one, they can just see the previous sessions also. Myself, Dr. Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune, and this is my code, that is ANAT10. So my code ANAT10 can be used by you. You can use this code as an unlock code and also for taking the plus subscription of Unacademy and getting 10% discount. So yes, here I am showing you my unlock code for unlocking all the sessions on the Unacademy platform, free sessions, and for taking the subscription. I would also like to tell you about the special class features. What are the features of special class? So when we are talking about special class, it's an interactive session where the educators and the learners can interact among themselves. Now, polls are conducted. So today also, as it is an MCQ session, so always I conduct the poll where you can ask your doubts, you can interact with me, and you can discuss your doubts, and it will be highly beneficial for you. Talk to your educator when the session is going on, and if you like the session, you can follow the educator, and after that you will get the notification of all the sessions which is taken. So all the sessions taken by me, either it is on the plus subscription of platform, either it is in the free platform of Unacademy, you will get the notification regarding that session. Now, my dear aspirants, once when I finish the session, lecture notes and PDF notes can be downloaded by you. That is extremely beneficial. Attend live sessions and from your own place, and with your own internet facility is the only requirement which is required, and you can study from anywhere. Now, what are the benefits of the plus subscription? Here, all 19 subjects which is required for targeting the entrance exam in the medical field, NEET PG, INICT, FMG examination, and next, all these 19 subjects is studied in a very systematic way, and all the important aspects of these 19 subjects for targeting a better rank is done by the top educators of Unacademy platform. So, but this is only available on the plus subscription. Actually, many sessions are available on the free sessions. But if you want the entire course and the entire session to be completed, you have to take the plus subscription. Learn from India's top educators on the Unacademy platform, compete in live tests and quizzes, study on the device of your choice and at your own place. And let's solve the latest pattern of 25,000 MCQs based on all 19 subjects made by the top educators of Unacademy platform, along with a explanation given to each and every MCQs. And soon there is, not only soon, it's already arrived, you will get printed notes of the Unacademy. If you take the plus subscription, you will get the printed notes of Unacademy platform. But the thing is that you have to take the subscription more than 1 year. Iconic subscription. The benefits of the plus platform is add-on with the benefits of the prep ladder. These are the two best platform in the medical field where you can assess all the versions of clinical cases, integrated essentials of prep ladder. You can get video lectures of the dream team of prep ladder, along with QBank free can be assessed, rapid revision, snapshots, and treasure dream notes, that is printed notes of the prep ladder will be provided to you. All these benefits. So all these benefits are there. So just go and grab this opportunity. So just go and grab the opportunity. Is highly beneficial for you. It's highly beneficial, my dear aspirants. So for iconic subscription, plus subscription, all these you can use my code ANAT10 and get 10% discount. Now, my dear aspirants, I would also like to share this slide where the NEET PG plus subscription and NEET PG iconic subscription is compared. You can also go through the demo live sessions, and you can attend the free live sessions on the Unacademy platform. You can use my code ANAT10. So I have included this code here, as you can see. ANAT10 is my code which can be used by you. If you want to take the plus subscription, you will get 10% discount by using this session. Now, updated highly effective QBank is assessed. So more than 25,000 MCQs are there which can be assessed by you and by the aspirants. So clinical MCQs from all the 19 subjects includes a detailed explanation given by the top educators of Unacademy platform. Use the code ANAT10 for getting 10% discount. My dear aspirants, boost your medical PG preparation by taking 24 months of subscription and getting 4 months of subscription absolutely free. Take 1 year of subscription and get additional 2 months of subscription absolutely free. Use this code ANAT10 and get additional 10% discount. Now, exam day, which is coming, so we will have an free sessions of practice of the MCQs and examination should be given. So for that, 2 to 5 p.m., 200 MCQs targeting the INICT 2021 examination free test. Monthly free grand test also targeting FMG examination. Timing is 10 a.m. to 1 p.m. and it contains of 300 MCQs. So these are occurring on 24th October is the INICT test, free test, and 31st October is the test which is free for the FMG examination. So just grab this opportunity and be present for the test. Use my code NAT10. So you can use my code NAT10 and get enrolled for these free tests. My dear students, also I want to tell you about the monthly free test for the targeting NEET PG 2022 examination. Timing is 2 to 4 p.m. and 120 MCQs are there. So just target this. Again, you can enroll by using the code NAT10. Raise your hand and get your doubts cleared in the live sessions of Unacademy platform. So congratulations to the toppers of Unacademy platform. These are I am very glad to share the images and photographs of all these aspirants who have targeted a very good rank and a good marks in the NEET PG September 2021 examination. So I'm very glad to share and I give them all the best for their future tenures. Now, can we start with the MCQs? All the best. Let's start with the MCQ session. You will get 15 seconds for solving each and every MCQs and there is 20 MCQs discussion. So let's start with the first. Targeting FMG examination. Episiotomy incision was extended posteriorly beyond the perineal body, injured structure immediately posterior to it. So which is the structure which will be injured, which is lying immediately posterior to the perineal body, and what is the structure injured? 4 options are provided, my dear aspirants: external anal sphincter, ischio-cavernous, bulbospongiosus, and urethral sphincter. Okay, so we have got 4 options. All the best. You will get 15 seconds. All of you do give the answers in the poll. Okay, and your time starts now. Okay, so very good. All the students has given a right answer. So best of luck. Very good. External anal sphincter. Yes. So I would like to show you a diagram which will make you clear the structure which is exactly located posterior to the perineal body. What is perineal body? Perineal body is a fibromuscular node where the many of the important muscles of the pelvic region is interlacing at that point. Here, this location is the perineal body. Can you see here? This is the location which is called as the perineal body. And here approximately 10 muscles are interlacing as we have already discussed here also previously. So this is the perineal body and the muscles which is interlacing. Actually, can you see this is transverse muscle? So this transverse muscle which is written here also, this is superficial transverse perineal muscle. So actually transverse muscle which is interlacing at the perineal body is superficial and deep transverse perineal muscle. Also these 2 muscles which you are seeing here, these are bulbospongiosus muscle, levator ani muscle. And my dear aspirants, what was the question asked? And clearly you can see just posterior to the perineal body, I am encircling this muscle. This is external anal sphincter. External anal sphincter is located just posterior to this perineal body. So this will be injured if the extension of episiotomy is done posteriorly. So we have seen here bulbospongiosus, the levator ani muscle of the both the side, superficial and deep transverse perineal muscle, external anal sphincter and longitudinal muscle coat of the rectum and anal canal is interlacing at the point of perineal body. Let's start with the next MCQ. All the best to everyone. Which part of the brachial plexus is not giving any branch? Whether it is root, trunk, cords, and division. Which part of brachial plex is not giving any branch? It is not giving any branch. The 4 options are there and let's target the correct answer. So all the best, everyone. Which part of brachial plexus is not giving any branch? Your time starts now. Okay, good one. So yes, many of the students has given the right answer. So the correct answer is division. The correct answer is division. Okay, yes, exactly. What is the location of division of the part of the brachial plexus? The part of the brachial plexus which is called as the division, it is exactly located behind the clavicle. So it is located exactly behind the clavicle, and we know that each trunk is giving A and P. What is A and P? Anterior and posterior division, and division is not giving any branch. No branch is given by the division. So many of you have absolutely given the right answer. Yes, retroclavicular sigh, you are absolutely right. Yes, it's lying behind the clavicle. Now, my dear aspirants, in this diagram, you can clearly see this is the root which is formed by C5, C6, C7, C8, and T1 ventral rami. The branches are dorsal scapular. So let me just zoom the image. You can see here the branches are dorsal scapular nerve having the root value C5. So these are the branches from the roots, and other than that, you can see long thoracic nerve, which is again having the root value C5, C6, and C7. Now, if I talk about the trunk, there is three trunk: UT for upper trunk, MT for the middle trunk, and LT for the lower trunk. The branches from the upper trunk, which is shown here, is nerve to subclavius and also suprascapular nerve. These two nerves are the branch from upper trunk. Now, you can see here, this is the division: anterior, anterior, anterior. These are posterior division, and you can clearly see no branches are given from the division. Now, after that, there is formation of lateral cord, which is giving lateral pectoral nerve, musculocutaneous nerve, and it's also providing lateral root of the median nerve. So if I zoom it out, it is also giving lateral root of median nerve. Now, branches from the posterior cord is mainly axillary nerve, the radial nerve, and upper and lower subscapular and thoracodorsal nerve. Branches from medial cord is medial cutaneous nerve of arm, forearm, ulnar nerve, medial root of the median nerve, and medial pectoral nerve. So I think most of you is aware of the branches. So branches of the cords of brachial plexus, all of you do revise, and this diagram you will get the PDF notes, download the PDF notes and revise the branches. Very important mnemonics are there. For example, branches of lateral cord can be done by the mnemonic ML2. What is ML2? Medical leave 2. M for musculocutaneous, L for lateral pectoral nerve, and lateral root of median nerve. If I talk about branches of medial cord, then M for you, me for you, M. 4 M are there. That is medial root of the median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm is there. Okay. And also we have got U for ulnar nerve. Okay. And medial pectoral nerve. From radial nerve, rats in the upper and the lower self. What is the mnemonic for the posterior cord? Rats in the upper and the lower self. R for radial, A for axillary, T for thoracodorsal. Upper and lower self ka matlab upper and lower subscapular nerve. So most of you are knowing this. Let's move on to the next. Jugular foramen transmit all of the following except. Your time starts now. We have got 5 options and you have to mark the right answer. Jugular foramen transmit all of the following except. Your time starts now. Question number 3, mark the correct answer. So, okay, 57% students have marked it right answer. The correct answer is sympathetic plexus. My dear aspirants, sympathetic plexus is not traversing through jugular foramen. If I talk about jugular foramen is divided into 3 parts. Okay, it is having an anterior compartment, it is having an intermediate part, and it is having a posterior compartment. So you have to know each structures passing through the various compartment of jugular foramen. So all these structures which is written here, 9, 10th and 11th, 9, 10th and 11th, jugular, vagus and accessory, inferior petrosal and sigmoid sinus, they are traversing through jugular foramen but not the sympathetic plexus. So see here, if I zoom this diagram, I would just want to show you the location of jugular foramen. So jugular foramen is the foramen which is located in the posterior cranial fossa. So we will target the posterior cranial fossa, where you can see here, yeah. So here, this is the jugular foramen location. Okay, in the here you can see just adjacent to the foramen, jugular foramen, and this jugular foramen is divided into 3 parts. So my dear aspirants, I would like to tell you about the structures traversing through each part. So all of you can write. If I talk about anterior part of jugular foramen, So can anybody tell me which structure passes through anterior part of jugular foramen? Anterior part. Anyone wants to reply? They can reply in the message box. Structures traversing through anterior part. Anterior part. LPS, anterior part of jugular foramen. I'm talking about jugular foramen. It's the inferior petrosal sinus. It's the inferior petrosal sinus. Okay, Asa? It's the inferior petrosal sinus. Now, my dear aspirants, I'm talking about the intermediate part. Intermediate part or compartment of jugular. Can anybody tell me? It's the 9th, 10th and 11th cranial nerve which is passing through the intermediate compartment. If I talk about posterior compartment of jugular foramen, this structure pass through the posterior part of the jugular foramen or the compartment, and the structures traversing are sigmoid sinus, which will continue as internal jugular vein, and also meningeal branches of which artery? My dear aspirants, meningeal branches of ascending pharyngeal artery and occipital artery. I have written in short form. So through the posterior, so all of you do revise, through the posterior part of jugular foramen, structures traversing is sigmoid sinus and meningeal branch of two arteries. Which artery? APA, anterior pharyngeal artery, and OA, occipital artery. So meningeal branch of ascending pharyngeal artery and occipital artery is traversing through posterior part or compartment of jugular foramen. So sympathetic plexus is the right answer. Let's move on to the next MCQ, that is MCQ number 4. Which is not a branch of vertebral artery system? Which of the following is not a branch of vertebral artery system? Basilar artery, posterior cerebral artery, posterior communicating artery, anterior spinal or ophthalmic artery? Question number 4, mark the correct answer. 5 options are there, and you have to tell me which is not a branch of vertebral arterial system, means not a branch of vertebral artery or basilar artery. And your time starts now. So yes, we have got 50% students has given the right answer, and the correct answer is ophthalmic artery. Absolutely right. Can anybody tell me ophthalmic artery is a branch of which artery? Ophthalmic artery is a branch of which artery? Ophthalmic artery is a branch of which artery? Absolutely right side. It's a branch of internal carotid artery. Absolutely right side. It's a branch of internal carotid artery. Rest all which is mentioned, basilar, posterior cerebral, posterior communicating, anterior spinal. These are the branches of vertebral arterial system, means branches of basilar artery or vertebral artery. Actually, two-side vertebral artery will join together to form the basilar artery. I would like to show you a diagram where you can see the important branches of vertebral artery and basilar artery. So let me show you the diagram. So I would like to zoom the image. So my dear aspirants, can you see here? This is the vertebral artery of right and the left hand side. Two-side vertebral artery is joining to form. So you can see here VA and VA. These are vertebral artery. Two-side vertebral artery is joining to form basilar artery, which is residing in the basilar circles of the pons, and it is giving pontine branches. What are the branches of basilar artery? Pontine branches, superior cerebral, posterior cerebral artery, and also anterior inferior cerebellar artery. And here you can see it is also forming a communication with internal carotid artery via posterior communicating artery. But ophthalmic artery is directly, we can't see the, here you can see this is the ophthalmic artery which is shown as a branch of internal carotid artery. So actually internal carotid artery is giving anterior choroidal, ophthalmic artery, middle cerebral artery, anterior cerebral artery. These are the branches of ICA, internal carotid artery. Important branches of basilar artery is posterior cerebral, superior cerebellar, pontine branches, anterior inferior cerebellar, and one more is there, that is labyrinthine artery. This is also the branch of what basilar artery. Two-side vertebral artery joins to form the basilar artery. So any doubt you can ask me. Is it okay? So you have to know the important branches of basilar artery, and you have to know the important branches of vertebral artery and ICA, internal carotid artery. Basilar artery branches, just now in the diagram I have shown you, the branches are, the terminating branches posterior cerebral, superior cerebellar, inferior cerebellar artery, and also labyrinthine artery, and also pontine arteries. Vertebral artery is giving anterior, posterior spinal arteries. Two-side vertebral artery joins to form the basilar artery, and it also gives posterior inferior cerebellar artery. Internal carotid artery is giving middle cerebral artery, anterior cerebral artery, ophthalmic artery, anterior choroidal artery. All these are the branches. So you can see here. Mnemonic. Okay. So actually, basilar artery, you can remember, I haven't made, so you can see here, if you want the mnemonic, actually I remember like this only. So you can see here in this diagram, let me erase this. Okay, now see here. This is the vertebral artery which is forming the basilar artery. So branches of basilar artery, you can know one important thing, the terminating of basilar artery is by posterior cerebral artery, and just adjacent to posterior cerebral artery is superior cerebellar artery. Then it is giving pontine artery and anterior inferior cerebral artery. So the best thing to remember is actually the branches of basilar artery is that it is giving branches to cerebellum. Okay, cerebellum, most important branches given is superior and anterior cerebellar artery is given by basilar artery. It also gives branches to the ear, internal ear, that is labyrinthine artery, and as it is located in the pons, so it is giving pontine branches. Okay. So please remember this diagram, and do remember, actually if you form a mnemonic also you will get confused. So what I want, actually now direct MCQs are not asked for the FMG and NEET PG examination also. They want you the concepts to be cleared. So I will not suggest to go for mnemonic for each and everything. You can have a look on this diagram, you can understand the things, and very nicely you will remember. Don't worry, you just remember 2 arteries to the cerebellum, 1 to the cerebrum. Okay, like that you can remember. Thank you. Okay, Sai. Yeah. Which is not a content within the parotid gland. Which of the following is not a content which is lying inside the parotid gland? So actually these are the structures: facial nerve, facial artery, retromandibular vein, parotid lymph node, and branches of facial nerve. So according to you, which of the following is not is located in the parotid gland? According to you, which is the correct answer? Question number 5, mark the correct answer. So, okay, 40-50% students has given the right answer, and the correct answer is facial artery. Actually, if you will see the parotid gland, the structure which is traversing our facial nerve and its branches, retromandibular vein, and also the external carotid arteries and the branches like maxillary artery, superficial temporal artery, not exactly the facial artery. Parotid lymph node is exactly located there. So we have to choose one structure which is not traversing inside parotid gland. So we will go with the facial artery. Actually, facial artery is just located over this mandible. So angle of mandible se ye traverse kar raha hai, then it is going towards the angle of mouth, and here it is giving superior labile and inferior labile artery. So it is not traversing inside the parotid gland. So B is the correct answer. I would like to show you this diagram. So here you can see the outline of parotid gland shown in the orange color. The structures traversing inside is the branches of the facial nerve. These are the branches of facial nerve. So you can see 5 terminal branches of facial nerve is traversing inside. You can see this is the trunk of facial nerve along with its 5 terminal branches. That is the temporal branches, zygomatic branches, buccal branches, mandibular, and cervical. Other than that, retromandibular vein. So this blue color structure is the anterior posterior division. So retromandibular vein is traversing. Also the superficial temporal artery, maxillary artery branches from there. External carotid artery is also traversing, and also the lymph node, but not the facial artery. So let's move on to the next MCQ, that is MCQ number 6. Which of the following area is involved in tibial nerve entrapment? So according to you, which is the structure which is compressing the tibial nerve? Okay, whether it is medial malleolus to calcaneus, whether it is lateral malleolus to navicular, medial malleolus to calcaneal tendon, lateral malleolus to that of the peroneus brevis, long plantar ligament to the tendon of peroneus longus. So your time starts now. We have got 5 options. Mark the correct answer. So yes, okay, let me explain. Actually, A is the correct answer. Medial malleolus to calcaneus. Medial tubercle of calcaneum bone. What is calcaneus? Heel bone. So actually, which structure is entrapping? The flexor retiniculum. So my dear aspirants, please see this diagram, which will clearly give you an idea. So if you want, I can just highlight this diagram also. Okay, so yes, can you see here? I have just highlighted this diagram. So actually, the flexor retiniculum is the structure which is having a connection between, it is a modification of deep fascia which is connecting medial malleolus to that of medial tubercle of calcaneum bone. Which bone is this? This is the calcaneus bone or the heel bone. So medial tubercle of the calcaneum bone. So this band of structure which you are seeing, here, okay, this band of structure which you are seeing here is the flexor retiniculum, which will compress the median nerve. Actually, you can see many structures. So from medial to lateral, the structures traversing here is the tibialis tendon, flexor digitorum longus tendon, tibial arteries and veins, posterior tibial artery, tibial nerve, and flexor hallucis longus. So these are the structures which has been mentioned here, is traversing from medial to lateral and can get compressed. These structures can get compressed by the flexor retiniculum. Okay, so the structures traversing is posterior tibial tendon, flexor digitorum tendon, posterior tibial artery and vein, tibial nerve, and flexor hallucis longus. So clearly we can see tibial nerve can be compressed by flexor retiniculum traversing from medial malleolus to medial tubercle of calcaneum. So this is the right option. So we have got A as the right option. Let's move on to the next. All the best for the question number 7. We have got 20 MCQs. Okay. To pronate the forearm, which of the following must occur? To pronate, pronation of the forearm can be done in which of the following order? A pronator quadratus muscle initiate the pronation and assisted later by pronator teres. Pronator teres is initiating the pronation and then get assisted by pronator quadratus. Anconius muscle is initiating the pronation and later by pronator teres. Ulnar nerve must be used. Pronator quadratus initiate assisted by anconius. So according to you, which is the correct combination for this correct answer? Question number 7, your time starts now. All the best to everyone. So, okay, I got just 17% students has given the right answer. So no worry, I will tell the explanation. Actually, the correct answer is A. My dear aspirant, the correct. So pronator quadratus muscle is the muscle which is initiating the pronation and the pronator teres muscle is assisting. So please do remember, this is the correct order of pronation. Pronation of the forearm. So see here, to pronate the forearm, pronator quadratus will initiate the pronation and it will be completed by the action of which muscle? Pronator teres. So please have a look on the muscle involved. Let's move on to question number 8. Palatine tonsil develops from which of the following pouches? First, second, third, or fourth? Question number 8, mark the correct answer. So yes, many of the students has given the right answer, and the correct answer is palatine tonsil develops from which of the following pouches? The correct answer is B. It's the second pharyngeal pouch. Is the second pharyngeal pouch. Now it will be more clear if I show you the diagram for it. So my dear aspirants, you can see we have got on one side pouches here, and this is the cleft which is mentioned, and the question which was asked was about the pouch. So let's move on to the pouch. So yes, from the first cleft, external auditory meatus is formed. But if we talk about the pouches, pharyngeal pouches, from the first pouch, two important structure is rising. The tympanic cavity and the auditory tube, eustachian tube. From the second pouch, palatine tonsil. From the third pouch, parathyroid gland inferior and the thymus gland, two structures. And from the fourth pouch is the parathyroid gland superior. So all of you can clearly see the structures arising from the pouches, and we have got the correct answer here. The palatine tonsil is arising. The palatine tonsil is arising from the second pharyngeal pouch. So second is absolutely correct answer. Let's move on to the next. That is question number 9. All the best. Now, all are the branches of femoral nerve except which of the following nerves are not a branch of femoral nerve? It's whether it is saphenous nerve, lateral cutaneous nerve of thigh, intermediate cutaneous nerve of thigh, or nerve to sartorius. 4 options are there and you have to give me the correct answer. Question number 9, mark the correct answer. All are branches of femoral nerve except. Okay, so yes, many students has given the right answer. The correct answer is lateral cutaneous nerve of thigh. Actually, lateral cutaneous nerve of thigh. So exactly what is the root value? Anyone remembers? What is the root value of lateral cutaneous nerve? Lateral cutaneous nerve root value. Anyone remembers? The root value of lateral cutaneous nerve is L2 and L3, and actually it is a direct branch of lumbar plexus. It's not a branch of femoral nerve, but it's a direct branch of lumbar plexus, the lateral cutaneous nerve of thigh. The other options which is mentioned here, nerve to sartorius, intermediate cutaneous nerve of thigh, and saphenous nerve. These are the branches of femoral nerve. So actually, saphenous nerve is a cutaneous branch from posterior division. Let me show you this diagram. So you can see here, this is the femoral nerve which is formed by the dorsal division of ventral rami of L2, L3 and L4. What is the root value? It is formed by dorsal division of ventral rami of L2, L3 and L4. Now, it again divides into anterior and posterior division. Now, my dear aspirants, when we are talking about the anterior division, it is giving innervation to sartorius muscle. The 2 cutaneous innervations and 2 cutaneous branches are given from the anterior division, that is intermediate and the medial cutaneous nerve of thigh. When I'm talking about posterior division, the branches are given to the muscles, that is the quadriceps femoris muscle, vastus lateralis, medialis, intermedius and rectus femoris, and 1 cutaneous nerve, that is saphenous nerve. Done. Let's move on to question number 10. First part of duodenum. Okay, all the best to everyone. So please mark the answer in the poll, participate in the poll. So first part of duodenum is located at the which of the vertebral level? Okay, so just attempt it, whether it is right or wrong, don't worry, I will come up with the explanation. So we have got 5 options and you have to give me the perfect right answer. Question number 10, mark the correct answer. T10, L2, L1, L5, L3. According to you, which is the best answer and best location for the first part of duodenum? So, okay, we have got 71% of the students has marked it right. Mcqs is leading, followed by Asha, JP, Sai, Jitu. Okay. The correct answer here is the first part of duodenum is located at the level of question number 10. The correct answer is L1. So L1 is the perfectly right answer. The exact location of first part of duodenum is at the level of first lumbar vertebra. Absolutely right. I would like to show you this diagram where the parts of the duodenum has been shown. And you can see here, first part is exactly located corresponding to L1. This is the second part at corresponding to the part of L1, L2, the horizontal part going towards the L3, and this is the fourth part. So this is exactly the location of the duodenum, different parts. Now, which of the following muscle is not properly matched with its main action? Which of the following eye muscle is not properly marked with its main action? Lateral rectus abducts the eyeball, superior rectus elevates adducts, rotates the eyeball medially, inferior rectus depresses adducts, rotates the eyeball medially, superior oblique adducts, elevates, rotates eyeball laterally, inferior oblique abduct elevates and rotates the eyeball laterally. So according to you, which combination is not correctly matched? Question number 11, mark the correct answer. Okay, so yes, we have got Mcqs is leading. Okay, the correct answer is D. Okay, my dear, when I was taking the class of orbit and extraocular muscles also, what I told you, always the oblique muscle is causing the action opposite to their name. So when I'm talking about superior oblique, what it will cause? It is the muscle which will cause superior oblique. So it will not cause elevation, it will cause depression. It will not rotate the eyeball laterally, but it will rotate it medially. And it is active in abduction. So totally the action of superior oblique muscle is wrong. Okay, always remember the action of oblique muscle is just opposite to their name. When I'm talking about inferior oblique, it will cause elevation and rotate the eyeball laterally, and it is active in abduction position. Superior oblique is active in abducted eye, and it will cause depression and rotate the eyeball medially, not laterally. All other options, lateral rectus corresponding to its name, abduction of eyeball, superior rectus, elevation, rotate the eyeball medially, and adducts, inferior rectus depresses the eyeball. So only D option is wrong. Let's move on to the next. Which of the following is true regarding stylomastoid foramen? So which of the following option is correct for the stylomastoid foramen? Question number 12. Located between styloid process and the mastoid process is sphenoid bone. Fifth cranial nerve is transmitting through it. Sensory nerve of face is traversing through it. Stylomastoid branch of posterior auricular artery traverses through it. Common site of lesion of glossopharyngeal nerve. So let's start. We have got 5 options, and question number 12, mark the correct answer. So yes, we have got Aisha leading, followed by Aisha is leading, followed by Mcqs, Sai, and JP. Okay, the correct answer is D. Stylomastoid branch of posterior auricular artery is traversing through stylomastoid foramen. Actually, stylomastoid foramen is located between styloid and mastoid process of sphenoid bone. No, that is temporal bone. Okay. Fifth cranial nerve, no. Facial. Sensory branch of face, no, dear. Motor branch. Common lesion for glossopharyngeal nerve is absolutely wrong. So glossopharyngeal nerve is traversing through jugular foramen, not through stylomastoid foramen. So we have got D as the correct answer. Yes, stylomastoid branch of posterior auricular artery is traversing through it. So D is perfectly correct. Stylomastoid foramen is located between the styloid process and the mastoid process of temporal bone, and the structure which is traversing through stylomastoid foramen is the 7th cranial nerve and also the styloid branch of posterior auricular artery. Stylomastoid branch of posterior auricular artery. So we have got D as the correct answer. And 33% students has given the right answer. Now let's move on to question number 13. So here also you can see this is the location of stylomastoid foramen. So let me just slightly zoom this diagram. You can see here this small foramen. Exactly, this is the styloid process. This is the styloid process of temporal bone. Okay, so it is lying close to the styloid process of temporal bone, not the sphenoid bone. Third part of vertebral artery is related to which of the following structure? Third part of vertebral artery is related to which of the following structure? Whether it is foramen transversum, anterior arch, superior articular facet, or posterior arch of atlas. So according to you, which is the most correct answer? Your time starts now. 4 options are there. Mark the correct answer. Okay, so yes, 50% students are correct. The correct answer is posterior arch of atlas. Actually, third part of vertebral artery is located. So actually, third part of vertebral artery, as we know, it is located in suboccipital triangle. It is located in suboccipital triangle. So, and in suboccipital triangle, we have got the floor structure is formed by posterior arch of atlas, where the third part of vertebral artery is resting. I would like to show this diagram. So see here, this is posterior atlanto-occipital membrane, and this is the posterior arch of the atlas vertebra. So these are the floor structures of the suboccipital triangle. of suboccipital triangle, which is shown here. And you can clearly see the third part of the vertebral artery is resting over the suboccipital triangle, is traversing in the suboccipital triangle as shown. Absolutely right. Let's move on to the next MCQ, that is MCQ number 14. Sagging of soft palate, deviation of uvula to the normal side, hoarseness might be caused by the lesion of which of the following nerve. So these clinical features are seen in the nerve injury. Which of the following nerve injury? Your time starts now. 5 options are there and you have to give me the right answer. Question number 14. Okay, 38% of the students are given the correct answer. Question number 14, 38% students has given the right answer. And the correct answer is vagus nerve. Absolutely right. Question number 14, vagus nerve. So 14C is absolutely correct answer. Yes. Actually, when we are talking about the innovation of soft palate and that of uvula, which is innovated here by the vagus nerve and hoarseness of the voice, so we can know that the larynx intrinsic muscle is also giving innovation by the recurrent laryngeal nerve, which is branch of vagus. So we have to choose one answer. So clearly vagus nerve is the correct answer. Okay, now moving on to question number 15. Which paranasal sinus communicate with the nasal cavity in the superior meatus? Question number 15, mark the correct answer. Which paranasal sinus is opening in the superior meatus? So 5 options are there: posterior ethmoidal, frontal, sphenoidal, maxillary. According to you, which is the correct answer? Your time starts now. So yes, 29% students has given the right answer. Mcqs is leading, followed by Sai, Aisha, JP. Great. The correct answer is posterior. Question number 15, the correct answer is posterior ethmoidal ear sinus. So actually lateral wall of the nose, this is an important question of anatomy and ENT also. In ENT also it has been asked. And you have to know there is 3 turbinates and just below this turbinate there is inferior, middle and superior meatus. And superior to it is sphenoethmoidal recesses. So you have to know that each structure is traversing or opening here. So in the space which is lying below the superior turbinate is called superior meatus. It's a narrow space inferior to superior nasal concha, and the structures traversing is posterior ethmoidal sinus. This was exactly asked in the MCQ, so this is the correct answer. When we are talking about the middle meatus, which is lying below the middle turbinate, the structures traversing is frontal sinus, maxillary, anterior and middle ethmoidal sinus. I would like to show you a diagram for it. Your concepts will be clear. So all of you do revise. This is very important, not only for anatomy, but also for ENT, the structures opening in these sinuses. So structure opening above the superior meatus, which is called as sphenoethmoidal recesses. The structures opening is sphenoidal ear sinus. Opening of superior meatus is posterior ethmoidal ear sinus, which was asked in the MCQ. And the opening of middle meatus is exactly elevation is lying on this elevation, which is called as bulla ethmoidalis. The structure opening is middle ethmoidal ear sinus. In the hiatus, so just below the bulla, in the middle meatus, we have got a semilunar hiatus, which is called as hiatus semilunaris, in which frontal ear sinus, anterior and maxillary ear sinus opens. And in the inferior meatus, we have got the opening of nasolacrimal duct. All of you download the PDF and revise all the structures which is opening in the lateral wall of the nose. Let's move on to the question number 16. Teres minor muscle is having the innovation by which of the following nerve? Axillary, radial, median and ulnar nerve. 4 options are there. Teres minor muscle is getting innovation from which of the following nerve? Axillary, radial, median or ulnar nerve. According to you, which is the best answer? Your time starts now. 4 options are there. Very easy one. Very easy one. Great. So all of you have given the right answer. Axillary nerve is the correct answer. Can you tell me, so students, can you tell me about axillary nerve is giving innervation to teres minor, and which other muscle? Which other muscle? All of you must be knowing. Which other muscle? Deltoid. Absolutely right. Deltoid muscle. Okay. So absolutely right. So these are the two muscles which is getting innervation from axillary nerve. And in the case of anterior dislocation of shoulder, axillary nerve is injured. Okay. Now, Brunner's gland is present in which of the part of the duodenum, or where it is present or not. So we have got Brunner's gland, which is also an important structure. So you have to tell me where it is located. It is it's exactly located in the mucosa of the duodenum. It's located in the submucosa of the duodenum. It's located in the muscularis layer of the duodenum, or none of the above. This is a question of histology. So take your time and tell me the correct answer, exact location of the Brunner's gland. Okay, so many of the students has given the right answer. The correct answer is submucosa of duodenum. Actually, it is a characteristic identifying. It is a very important histological feature. It's a characteristic identifying and a histological feature for the histological slide of duodenum. Okay, so duodenum के लिए अगर हम characteristic identifying features की बात करें तो it is having Brunner's gland in the submucosa layer of duodenum. So let me show you. So here you can see this is the duodenum, where you can see these are the villi. So how you are going to identify the duodenum slide? It is having villi. As you can see here, it is having villi. Okay, on the villi you can have the microvilli. Okay, microvilli is located. So can anybody tell me what is which type of microvilli is lying in the duodenum? Which type of microvilli? What is the type of microvilli which is located in the villi part of duodenum? Lost the connection. Okay, just check Mcqs. Brunner's gland is located in submucosa part of the duodenum. I am asking you one question. So we know that microvilli is lying on the villi aspect of duodenum. Which type of microvilli is present in duodenum? Whether it is striated or brush border. Whether it is striated or brush border. Sai is telling brush border. Okay, if I talk about duodenum, which type of microvilli, striated or brush border? Others want to give the answer? Which type of microvilli? Which type of microvilli is present in duodenum? Striated or brush border? Sai has told about brush border. Anyone else wants to give the answer? Striated. My dear, it is striated. Why it is striated? There is regular arrangement of microvilli, and this is present in the small intestine. Next layer which you are seeing is the mucosa and submucosa. So in the, don't worry, it's okay. In the submucosa, can you see here so many glands are there? So in the submucosa layer, there is Brunner's gland, and this is the characteristic identifying feature of the slide of duodenum. Adjacent to that of the Brunner's gland, we have got muscularis externa. So 4 layers of GIT will be there. Outermost is the serosa. So 4 layers में कौन सा होता है? Histological mucosa होता है. Then we have got submucosa. Then we have got muscularis externa, and the outermost layer is serosa. My dear aspirants, in this submucosa layer, we have got Brunner's gland. Mucosa again can have the epithelium layer, then it can have the lamina propria and muscularis mucosae. So all of you just go through all the layers of the GIT, and the Brunner's gland is the characteristic feature for the identification of the slide of duodenum. So we will go with B as the correct answer. Okay, everyone, have you understood? Any doubt? Let me know. Can we move on to next MCQ? Is it okay? So give me a thumbs up if is it okay. We can move on to the next MCQ. Yes, so let's move on to the next. All the best. Question number 18. Okay, thank you. All of the following are in the anterior relation of the right kidney, except all of the following structures are anteriorly related in the right kidney. Okay, except duodenum, spleen, liver. Okay, Sai, I'm coming to your answer. Firstly, let's solve this MCQ, then I will give you the answer, Sai, okay? So yes, all of the following are anterior relation of right kidney except duodenum, spleen, liver, large intestine. So according to you, question number 18, mark the correct answer. Okay, so yes, Sai is leading with 13 correct, followed by Aisha, JP, great. So yes, absolutely right. Spleen is lying on the anterior aspect of left kidney. Don't worry, I will show you the diagram and all of you are absolutely right. Yes, Sai, what is your doubt? Jejunum and ileum. Yes, Shai. Actually, when I am talking about small intestine as a whole, please note down, when I am talking about small intestine as a whole, small intestine is having mainly the duodenum, jejunum, ileum. So yes, absolutely right, Sai. All these three parts, the microvilli will be regularly arranged. Okay, there will be a very regular arrangement of microvilli, and due to the regular arrangement of microvilli, the term which is used is striated border. इसको क्या बोलते हैं? We called it as a striated border. So striated border means regular arrangement of microvilli, and this is the characteristic point which is seen in the slide of the small intestine. When we talk about gall bladder, अगर हम gall bladder की बात करें तो यहाँ पे जो microvilli है, the arrangement of microvilli is irregular. The arrangement of microvilli is irregular and the term which is used is brush border. Okay, so अगर हम gall bladder की बात करें, when I am talking about gall bladder, the arrangement of microvilli is irregular and the term which is used is brush border. Is it okay, Sai? Have you understood? Welcome, dear, welcome. So I would like to share this image where you can appreciate the anterior relation on the right anterior aspect. So this diagram is showing anterior relation of right and the left kidney. So on the left kidney, you can see the splenic area is located, gastric area, suprarenal is both common for right and the left side. Colic area and jejunum is also common. The difference, so three important structure which is only seen in the left hand side is the stomach, gastric impression, pancreatic and splenic. When I'm talking about the right hand side, hepatic and duodenal area is lying. Okay, so hepatic and duodenum area will be related on the right anterior aspect of the right kidney. And when we are talking about gastric, splenic and pancreatic area, these structures will be located on the anterior aspect of the left kidney. Actually, in 2019 AIMS entrance exam, they have asked this question where they have pointed an arrow. So this was in the form of image based question. Wahan pe the image was by pointing an arrow was marked at the splenic area and the question mark was that which area is related. So the next point is that ki aapko identification hona chahiye which is the right and the left kidney. So other hint is that this is what? This is inferior vena cava. So how you are going to identify which is right kidney and left kidney? Inferior vena cava is closer to which kidney? Everyone can appreciate in the diagram. Inferior vena cava is closer to which kidney? Right or left kidney? Right, yes. So that is a hint which will give you that this is the right kidney. So image where inferior, same image was given of a cadaveric image, and then inferior vena cava is closer to the right side. So we will get a hint that this is the right kidney, and then you can know the relation. So that is the relation which you have to keep in mind when solving the image-based MCQs. Okay, all the best. So let's move on to the next MCQ. All the best for the next MCQ. Okay. Is it okay, everyone? Yeah. Just a minute. All of the following is a modification of D fascia except. All of the following is modification of D fascia except retinaculum, aponeurosis, flexure fibrous sheath or mesocolon. So which of the option is not a modification of D fascia? Question number 19, 4 options are there. Mark the correct answer. Okay, so good. So yes, the correct answer is D, that is mesocolon. Absolutely right. So what is mesocolon? It's a modification of anyone. What is mesocolon? Mesocolon is a modification of anyone wants to give the answer. Mesocolon is a modification of its structure. Yes, all of you are right. Now the next question which I am asking is mesocolon is modification of its structure. Peritoneum. Yes, absolutely right. It's a modification of peritoneum. Absolutely right. Now, when I'm talking about D fascia, the modifications are retinaculum. So it will form fibrous flexor sheath, retinaculums, aponeurosis, and also it will form tendons, it will form ligaments. So all these will form introosseous membrane, it will form capsules, it will form many of the structures. So all these structures which is mentioned here are the modification of D fascia, but not the mesocolon. Mesocolon exactly is the structure which is formed by the fold of peritoneum. Okay, so that is exactly the peritoneum, and peritoneum is having a lining epithelium. Can anybody tell me what is the lining epithelium of peritoneum? What is the lining epithelium of peritoneum? Anyone? What is the lining epithelium of peritoneum? Question mark. What is the lining epithelium of peritoneum? So yes, I got an Aisha has given the right answer. It's the simple, no, not simple columnar. No, Aisha, it is cuboidal. No. Peritoneum is lined by mesothelium. Peritoneum is lined by mesothelium. So lining epithelium is simple squamous epithelium. All of you please write down. The lining epithelium is simple squamous epithelium. Okay, simple squamous epithelium. The lining epithelium of peritoneum. So peritoneum is having a epithelium lining which is called as mesothelium, and the example of the epithelium will be simple squamous epithelium. Simple squamous epithelium. Yes. So let's move on to the next MCQ. Perichondrium is present in all except articular cartilage, glenoid labrum, intervertebral disc, or epiglottis. So in which of the following perichondrium is not present? 4 options are there. Mark the correct answer. Okay, so yes, great performance. Asa has performed nice. Sai, great one. JP, Mcqs, Jitu, great one. So everyone has performed nice, and important is participation. Actually, epiglottis is correct answer. Now let me explain you how. Now epiglottis is an example of which type of cartilage? Can anybody tell me epiglottis is an example of which type of cartilage? Epiglottis is an example of which type of cartilage? Epiglottis. Elastic cartilage. It's an example of elastic cartilage. So it's an example of elastic cartilage, my dear aspirants. So elastic cartilage is having perichondrium. Perichondrium is present in elastic cartilage. So yes, so that is the reason epiglottis is correct answer. When I'm talking about articular cartilage, glenoid labrum, intervertebral disc, glenoid labrum, intervertebral disc, it's an example of fibrocartilage. Articular cartilage is a variant of hyaline cartilage only. So these articular cartilage, no perichondrium, glenoid and fibrocartilage is also having no perichondrium. So why epiglottis is the correct answer? Why? The reason is that epiglottis is an example of elastic cartilage, and elastic cartilage we have already seen in the histology session. It is having a perichondrium which is lying on the outer aspect, which is giving rise to the chondroblast. So it is having cellular layer and fibrous layer. As we know that cartilage is an avascular structure, so their nutrition is provided by the perichondrium. So epiglottis, example of elastic cartilage, perichondrium is present, but not in the fibrocartilage and articular cartilage. All these A, B, C is not having perichondrium present over it. So that was correct. Now, before ending the session, I would like to tell you thank you, and I also want you to do subscribe the Let's Crack NEET PG YouTube channel. Let's Crack NEET PG YouTube channel. And where yes, thank you so much, JP. And also I want to tell that when I will finish the session, you can download the PDF notes and can have a revision, and you can see the session. So like and subscribe the Let's Crack NEET PG. And those who want to take the subscription of Unacademy, they can use the code ANAT10. So use the code ANAT10 and get 10% discount if you want to take the subscription of Unacademy and special free session. So all of you do present live, because I'm going to have many free sessions in the coming sessions, and also on the YouTube session channel, I am going to take many of the sessions. So okay, Sai, when is the next session? So tomorrow is Friday, and Sai, tomorrow I'm taking 2 sessions on the YouTube. So be present live on the YouTube Let's Crack NEET PG platform. And Saturday also there is a session on YouTube. And again, in the coming session, I will update the schedule and timetable. So next week, sure, we will have many sessions. Okay, I think by this way, if we are going to solve many MCQs, we can cover up the entire anatomy. Okay, all the best. Do present. Thank you so much. Thank you, students. Thank you. Thank you, everyone. Thank you, Sai. Thank you. Thank you, Virendra. Thank you, JP. Thank you, Aisha. Everyone. Thank you, everyone.